everyone, welcome to our Spotlight interview. My name is Alice, Coordinator of Asian Community Program at Surrey Hospital's Foundation. I will be your host today for this interview. We're so excited to have Celine here today to talk about children and youth mental health problems, the symptoms, possible impacts, and information on prevention and treatments. Celine is an occupational therapist at one of our 4 children and youth mental health programs at Surrey Memorial Hospital. Before introducing Celine, I would like to talk about the role of Surrey Hospital's Foundation and what we do here. Surrey Hospital's Foundation was established in 1992. This year is our 30th anniversary. The Foundation supports 3 major health care facilities in Surrey, including Surrey Memorial Hospital, which houses one of only 2 pediatric ER in BC, Jim Pattison Outpatient Care and Surgery Centre, which is a standalone facility that provides a complete range of scheduled outpatient services. And lastly, Cherney Alzheimer's Center, which is home to 72 Alzheimer patients. Surrey Memorial Hospital is the regional acute children and youth mental health center in the Fraser Health region. Our mental health programs provide treatment and care for children ages 6 to 18. With Surrey being the fastest growing city in the province, do you know that 43% of kids are living in the region, and 1 in 7 children experience mild to severe mental health concerns? This number has increased to 1 in 4 children during the pandemic. Mental health disorders can start appearing at the age of 14. Unfortunately, it is now leaning towards the age of 12. So we must ensure children have access to the best resources and healthcare. Now, let's introduce Celine, who will share her background with us and discuss the importance of children and youth mental health. Hi, Celine.
Hello.
Thank you very much for taking your time today to do this interview with us. So can you please tell us a little bit about yourself and your background?
Yeah, so my name's Celine. I'm an occupational therapist who currently works in the Child and Adolescent Psychiatric Stabilization Unit, also known as CAPSU, at Surrey Memorial Hospital. I've been working as an occupational therapist for 7 years, and I love the opportunity to work with children and youth in their journey to recovery and wellness. So in my free time, I love to bake, as this is a big stress reliever for me. And I even started my own baking business to drive this passion further.
Wow, so thank you very much for sharing your background and your hobby with us. So today we're going to talk about mental health. And mental health has been a big topic in our community. So can you tell us what is mental health and why it is so important to us?
Yeah, so mental health includes our emotional, psychological, and social well-being. It's all about how people think, feel, and behave. It can affect our daily living, relationships, and physical health. Specifically in children and youth, mental health can affect how well kids do in school and how they form relationships with other kids and adults. Mental illness, if not treated early, can be disruptive enough to a child's normal development, and it can also affect their daily functioning and participation. So mental illness, between 50 to about 70% show up before the ages of 18. So according to the Canadian Institute of Health Information in 2020 to 2021, nearly 1 in 4 hospitalizations for children and youth ages 5 to 24 years old were due to mental health illnesses. So being quote-unquote healthy isn't just about physical health. It also means having stable emotions, self-acceptance, getting along with others, and having a positive attitude towards life.
So based on what you said, mental health plays such an important role in someone's growth, especially children and youth. So can you tell us what are the most common mental health problems seen in children and youth?
Yeah, so between ages 6 and 18, the most common mental health disorders are mood disorder, depression, anxiety, obsessive compulsive disorder, also known as OCD, bipolar, attention deficit hyperactivity disorder, ADHD, autism spectrum disorder or ASD, paranoia, post-traumatic stress disorder, PTSD, conduct disorder, eating disorder, and suicide. Suicide being the second leading cause of death among ages 15 to 24 in BC. So, example of the causes could be fear, stress, negative family environments, family conflict, and loss of supportive relationships with their family members and friends. And mental illnesses can show up and affect individuals of all different family types and cultural backgrounds. In certain situations, individuals may be more prone and higher risk to mental illness in situations such as family history, being new immigrants or refugees, going through major life changes such as moving to a new city or a school, individuals who have faced or witnessed trauma, including various types of abuse, and also exposure to substances.
Wow. So there are so many different common health and mental health disorders, and we definitely should not ignore these causes. So other than causes, are there any signs or symptoms that we should be aware of?
Yeah, so many children and youth will exhibit different moods, thoughts, and behaviors of various types that can be part of normal child development. These can include changes in their behaviors, such as an active child becoming more reserved, good students suddenly getting poor grades, loss in, or gain in interest in activities as well. So some further signs may include avoidance to places or situations they don't typically avoid, sudden changes in emotions, showing signs of difficulty coping with regular activities and everyday problems, and also starting to keep to themselves. But these characteristics and behaviors may be signs of underlying mental concerns or disorder if they are intense, persist over a long period of time, or interfere with a child's life. So, when a child and adolescent is experiencing a mental health crisis, they often feel anxious, frightened, and out of control. They don't always know why they feel the way they do, or they become upset and agitated, and their crisis may escalate.
Hmm. So these examples of signs and symptoms are, very helpful and, for sure will be a guideline for parents or caregivers to pay attention to. Now, so can you tell us briefly what children and youth mental health services are provided at Surrey Memorial Hospital?
Yeah, so Surrey Memorial Hospital is the only hospital in Fraser Health region that has 4 mental health programs that provide treatment and care to children and youth. So 9 hospitals in Fraser Health will transfer their young patients to us after assessment, so our demand is pretty high. It's all because we have such a great team, but also because we have the programs here. So the first program is the Short-Term Assessment Response Treatment, also known as START. So START supports children and youth between ages 6 and 18 who are experiencing severe mental health crises. This unit receives calls from hospitals, schools, parents, and patients. They will begin with an assessment to gather information from parents and youth to understand their situation. And then the second program is the Child and Adolescent Psychiatric Stabilization Unit, also known as CAPSU. CAPSU was opened in 2017. It's a 10-bed unit that offers services to patients ages 6 to 17, and the average length of stay ranges from 1 day to a week. So we have a multidisciplinary team, which also includes a peer support worker who has personal lived experiences with their mental illness. CAPSU also has an innovative therapeutic environment known as the Snoozlin Room, or we call it the Sensory Room. It's the first of its kind in Fraser Health. The environment offers a quiet space for individuals to offer sensory stimulation for different ages, learning, and cognitive levels. This is possible because of the generosity of Surrey Hospital Foundation's donors. The third program is the Adolescent Psychiatric Unit, also known as APU. It is located within Surrey Memorial and provides longer-term stays for youth struggling with mental health challenges. This unit offers services for youth from ages 12 to 17. The program begins with treatment, which offers individual assessments, group activities, and school components to support academic needs. They offer an outdoor space for recreational activities such as playing basketball and gardening. And the last program is the Adolescent Day Treatment Program, also known as ADTP. This program is for youth from 13 to 18 who are unable to attend regular school. The program happens to be at Shirley Dean Pavilion, which is right across from the hospital. The focus is to help patients to learn essential life skills to reintegrate into the community and school system. So ADTP is a day program where patients are dropped off and picked up each day by family members. The program provides many therapy treatments such as recreational therapy, family therapy, group therapy, music therapy, as well as art therapy. ADTP also has an outdoor courtyard. It's a multi-purpose space where many activities take place, including an outdoor gym, a vegetable garden, and outdoor space for groups. Youth can grow all kinds of vegetables and fruits in this courtyard and prepare meals. It's a very therapeutic space where youth can feel relaxed and safe and calm. It can also help youth understand the importance of starting a project and finishing it. Seeing the results of a project can be very fulfilling, and though lots of effort. This courtyard is a very important space, but it's also very outdated and needs renovation. There's no proper greenhouse or storage or proper seating areas, so all these demands are crucial to the program.
So thank you very much for sharing all these 4 important children and youth mental health programs at Surrey Memorial Hospital. So from your experience, what is the average number of kids admitting to your unit, CAPSU? Is there a certain period that the number will be higher, and how has the pandemic affected the number of patients?
Yeah, so in the past 2 years, we've seen a drastic high admittance rate to CAPSU for children and youth struggling with mental health challenges. In fact, we often see a spike before the school year starts and in September and October, as it is a transition period for many kids. So during the pandemic, the daily routine of kids may have changed. Many have lost their social interactions with friends, and some choose to stay in their rooms and be distanced from others. Some families also develop other family conflicts as well. So many families may not know how to handle young children with mental health challenges. They might not recognize the problem or may have misconceptions about mental health. Parents and guardians should not ignore these symptoms. Immediate care and treatment and advice from professionals are very important to children and families.
You're so right. Yeah, because I think change in environment can definitely affect mental health, especially for kids. When children are experiencing mental health challenges, they often feel anxious, frightened, and may not know how to express themselves. And some may not be able to explain their behaviors. So, are there any treatments that could help them?
Yeah, so in the hospital, we have 3 mental health programs, youth therapeutic programs such as music and art therapy. So these results have been seen as very successful. So music therapy encourages patients to access their inner feelings and emotions through lyrics, playing instruments, and songwriting. Art therapy allows patients to feel calm and safe, and it helps reduce feelings of agitation and anger as well.
Hmm. Yeah, thank you very much for sharing again. It's very important that all these therapeutic programs, continue to run. So lastly, can you share with us some prevention tips?
Yeah, so firstly, the parents can provide a safe home and environment for children and youth. You want to share with them how to handle stress and also their emotional problems. The whole family can also find an activity that the youth or children love to do. Encourage and teach your children to be positive and grateful. For instance, like each day they can write down 3 things that they're grateful for. Speak to your child regarding your main concerns, but don't go more than 3 and keep it brief. More communication, so listen to their response for an uninterrupted 3 minutes if you can. Let your child know that you'll help them work out different issues together. And then arrange to meet with a trusted and trained professional to discuss your concerns and how to access help. You don't have to do this alone, and help is always available. So, if you notice any small changes, mild emotional distress, and some difficulties in day to day activities, you should not ignore these problems. You can write them down and then discuss with a trained professional. There are many mental health clinics in the community. They provide free services including assessment, diagnosis, and treatment for children under 18. But if you think that your child has the intention to harm themselves or put others at risk for safety, please call 911 or go to emergency immediately.
Celine, thank you very much for doing the interview with us today and sharing so much information about children and youth mental health.
Yeah, thank you for having me share about this important topic.
Thank you. So through today's interview, we hope our audience have learned more about children and youth mental health. And we are so proud that Surrey Memorial Hospital offers so many mental health services for our children. Donor support is very important in helping us to continue to support children and youth who are facing mental health challenges. And many treatments are not currently supported by the government, and they are essential for young patients' recovery. Children are our future. We need your help. And doesn't matter how small or big your gift is, it will benefit our young patients. So please consider donate today or sign up to be our monthly donor. Your donations will ensure our children receive the best care they need at Surrey Memorial Hospital. To make an online donation, please visit our website at www.surreyhospitalsfoundation.com/donate, or you can call us at 604-588-3371. 604-588-3371. So thank you very much for joining us today, and thank you, Celine, for joining us today. See you next time. Goodbye.
Thank you. Bye.
Bye-bye.